I've spent some time at addiction treatment clinics and talking to people in that community. And it's very clear that, of course, there are a huge number of factors that play into why people become addicted and relapse, et cetera. But if you can get at people's ability to control their anxiety and their feelings of peak states and happiness, you don't guarantee, but you help reinforce the possibility that they're going to get sober and stay sober. As an addict gets more tethered to the idea that some substance is the thing they need, the progressive narrowing of the things that bring them pleasure, and everything else kind of falls away like portrait mode on the phone. They're essentially in a state of high stress trying to meet that dopamine need all the time. And they don't see other possibilities. The reason I mention not just stress and treating stress to get at addiction, but also pleasure is that we've also seen this. When do people relapse? When they're feeling really good. When they're feeling really lousy and stressed, and when they're feeling really good.
Yeah.
They've been sober for 5 years. We hear about this in the news, usually from celebrity examples. People have been doing great. All of a sudden, they're back in treatment. And you're like, what happened? Well, what happened was the dopamine circuit from other things, maybe a great life event or things are going well, or stress, the loss of a job, everything crashing, puts our visual system and the rest of our brain into a myopia. We literally become nearsighted, and the dopamine system says, that's the only thing that's gonna get me out of the mode that I'm in. They literally don't see the other possibility. You can tell somebody you're gonna lose your kids and they'll do it anyway. And that just tells us we need another route to it. And so one of the things I think is powerful is to think about, how can we leverage the visual system? How can we leverage the diaphragm system? In the same way that you would tell somebody who's has cancer or needs a surgery of a certain sort, like we need to leverage certain technologies. And so what we need to do is we need to dilate their perception of the world around them. We need to dilate their perception of time. They need to learn how to relax themselves so they can actually see other options. And it all relates to how the visual system and the breathing system relate to autonomic function. The ability to recognize that I'm not seeing clearly, right? I see what I see, but I don't know what I don't see. The ability to introduce that understanding for somebody can be very powerful. And I think we need to give them tools that they can look to very quickly.